Dear learners, I once again welcome you to this MOOC on population and society. In the previous week modules and videos, we have discussed about the various aspects of Indian population. In this week, we shall be mainly discussing about the population policies and programs. This is the first video of the week, and here we shall deliberate upon the need and significance of population policies and the different types of population policies. So let us begin. The objectives of this module are to examine the evolution of India's population policies, to focus on the National Population Policy of India, to explore the features of National Population Policy India, to understand the role of United Nations and other international agencies, to recognize population policies for special groups. So let us now begin, learners, by the meaning of population policy. So the ad hoc consultative group of experts on population policy set up the Population Commission of the UN Economic and Social Council has included in the population policy measures and programs designed to contribute to the achievement of economic, social, demographic, political and other collective goals through affecting critical demographic variables, namely size and growth of population, its demographic distribution and its demographic characteristics. Now, the three major features of any population policy as outlined by Berelson are, firstly, the action taken by the government in the form of a statement of position, laws, decrees or administrative programs. Second, it covers events of population. And third, it refers to both intentions and consequences, that is, the actions that are designed to alter population or events to actually alter them. Few other characteristics are: a government will examine its past and present population demographics in order to predict future population demographic trends, changes. Also, this aids in determining the optimum population size for the resources a country has, and this will subsequently lead to the most suitable population policies being chosen for the country. Also, different population policies have different components, and therefore the three main elements which are considered when deciding on a population policy are fertility, mortality and migration. This is because all demographic variables are influenced only through these three variables. Now we need to understand more about a population policy. So a population policy, dear learners, is a set of measures which are taken by a country to modify the way its population is changing, either by promoting large families or immigration to increase its size, or by encouraging limitation of births to decrease it. In other words, such policies are implemented by governments and are a series of actions that have been introduced in a country to adjust the country's population size. Now coming to the different types of policy, we have number one, the mortality influencing policies. So we'll try to understand what this means. So these are policies that relate to mortality, and it obviously aims at reducing mortality. Post Second World War, the World Health Organization introduced a dramatic concept of public health and resolved to eradicate the diseases such as malaria, cholera, which were termed as mass killers. Later, we had a population conference in 1974 United Nations Secretariat, which stated that, as it might be expected, all governments have formulated policies to reduce morbidity, mortality. Also, the World Health Organization and United Nations Children's Fund 1979 emphasized that a main social target of government, international organizations and the whole world community should be the attainment by all people of the world by the year 2000 of a level of health that will permit them to lead a socially and economically productive life. So coming to the second type of policy, which is migration influencing policy, these are policies which are concerned about migration and are focused mainly on two aspects: internal migration and external migration. So some factors relating to these may be job opportunities available, the nature of terrain, the factor of cultural affinity, and these play a pivotal role in determining migration. We also have the third type, which is fertility influencing policy. So such policies may be of two types: the pro-natalist policies, which have existed since ancient times and were justified on grounds of high mortality conditions, and they flowed from a populationist philosophy which equated power and prosperity with large numbers. We also have the anti-natalist policies, which have been advocated from time to time by different groups of people with varying social and political ideologies. Philosophers like Plato, Aristotle stressed the importance of the quality of population. Later, attention was also again focused on controlling population when Malthus published his essay on principle of population as it affects the future improvements of society. In more recent times, learners, we have Margaret Sanger, who championed the cause of birth control as one of the most important rights of women. Today, the need for having a demographic goal is once again considered to be of paramount importance. Now let us focus on the evolution and development of population and health related policies. So the evolution and development of population and health related policies have undergone significant shifts over time, reflecting changing societal needs, advancements in healthcare, and evolving understanding of population dynamics. So here's a broad overview. We'll start with the early history, which is ancient civilization, where historical records suggest that it had rudimentary forms of population policies relating to health, sanitization, disease control, etc. We then have the Industrial Revolution and public health, which leads to urbanization, overcrowding in cities, prompting the need for better public health policies to address sanitation, housing, and disease control. We also have the 19th century, where public health reforms started taking shape, focusing on clean water, waste management, and the establishment of health boards. Also in the 20th century, post-World War II, there was rapid population growth after World War II led to increased attention on family planning and birth control. In the 1960s-70s, the modern era of population policies began, which emphasized on family planning, reproductive health, and access to contraceptives. Later, there was a Alma-Ata Declaration of 1978, which was a landmark event emphasizing on primary health care for all, addressing broader health needs beyond mere medical treatment. And the recent trends, which focus on reproductive rights, emphasis shifted from mere planning to reproductive rights, which encompassed the broader aspects of sexual health, gender equality, and the access to comprehensive healthcare services. Also, health was considered a human right. The concept of health as a fundamental human right gained prominence with efforts to ensure equitable access to healthcare services for all, regardless of socio-economic status. Lastly, we have contemporary policies and SDGs, Sustainable Development Goals, which are global goals established by the United Nations, including targets relating to health, SDG 3, and well-being, aiming to ensure healthy lives and promote well-being for all ages. We also have the universal health coverage, which aims to provide essential healthcare services to all individuals without financial hardship. Also, latest, the COVID-19 response, which highlighted the importance of global health policies, emphasizing the need for preparedness, equitable vaccine distribution, and resilient healthcare systems. And now the ongoing challenges. There is the problem of population aging, there is health inequalities, there is disparity in healthcare access, persist globally and require targeted policies to address issues of socioeconomic, geographical, and gender-biased disparities. So, we can say the evolution of population and health-related policies reflects a continuous effort to adapt to changing demographics, societal needs, and emerging health challenges while striving for equitable access to healthcare and improved well-being for all. Now, dear learners, let us try to understand the role of United Nations and other international agencies in population policy. The United Nations, which will be referred to as UN, and other international agencies play a crucial role in shaping, advocating, and implementing population policies worldwide. Their functions encompass, firstly, population development and guidance, where they provide guidance and technical expertise to countries in developing population policies. They offer insights, data, research to government aid in formulating policies that address demographic challenges such as population growth, aging, migration, and health. Second, we have advocacy and awareness, where these agencies advocate for evidence-based population policies and promote awareness about issues relating to population growth, reproductive health, gender equality, and family planning. Thirdly, we have resource allocation and aid, where international agencies often allocate funds and resources to support countries in implementing population policies. This can involve financial aid, technical assistance, and capacity building initiatives, which aims at providing healthcare, education, and infrastructure relating to population management. Fourthly, we have data collection and analysis. The United Nations and its agencies facilitate the collection and analysis of demographic data globally. This data is essential for understanding population trends, identifying challenges, and formulating effective policies to address them. Fifthly, we have international collaboration. These encourage cooperation and collaboration among nations to tackle shared population-related challenges like migration, healthcare, sustainable development, etc. Sixthly, we have monitoring and evaluation. These agencies often monitor the implementation of population policies and assess their effectiveness. They try at aiming to improve policy outcomes and adjust strategies where necessary. Seventh, we have human rights and gender equality, where the United Nations emphasizes more on gender equality, human rights in population policies. Though they advocate policies that ensure access to reproductive health services, empower women, and promote gender equality, aiming for inclusive and equitable societies. In essence, the United Nations and other international agencies act as facilitators, advisors, and supporters to countries, assisting them in developing and implementing population policies that are both responsive to local needs and aligned with global development goals. Dear learners, we now shall focus on the different World Population Conferences which are of utmost importance to understand more about population policies. We firstly have the World Population Conference, which was held in Bucharest in 1974, then in Mexico City 1984 and Cairo 1994. These were pivotal events in shaping global discussions and development. A brief review of each conference shall be discussed as follows. We have the World Population Conference Bucharest 1974. We'll mainly understand the focus, and it was the first global gathering on population issues organized by United Nations. The key discussions, it focused on population growth, family planning, and reproductive health. There were debates on relationships between population, development, and individual rights. Next, we have outcomes. The conference affirmed the importance of family planning services and reproductive health, but sparked disagreements on the nature of population control programs. It highlighted the need to approach population policies in the context of broader socio-economic development. Next, we have the International Conference on Population and Development, ICPD, Mexico City, 1984. The focus, it focused on the relationships between population, development, and human rights. The key discussions, it emphasized the significance of women's rights, gender equality, access to education and healthcare services, including reproductive health. Outcomes, the Mexico City Conference stressed the integration of population concerns into broader development strategies. It promoted a shift from demographic targets to a more human-centered approach, recognizing individual rights and dignity. Next, we have the International Conference on Population and Development, ICPD, Cairo, 1994. The focus, Cairo Conference was a landmark event that expanded the discussions from demographic issues to broader socio-economic development and human rights. The key discussions were emphasizing on reproductive rights, gender equality, women's empowerment, and access to reproductive health services, including family planning. The outcomes, the Cairo Conference resulted in ICPD program of action advocating for comprehensive sexual and reproductive health services, education, and gender equality. It stressed the importance of empowering women and recognizing reproductive rights as human rights. These conferences marked a shift in approach, recognizing the complex interplay between population, development, and human rights. They highlighted the importance of empowering individuals, especially women, and promoting access to comprehensive reproductive health care as essential components of sustainable development agendas. The outcomes of these conferences have significantly influenced global policies on population and health, shaping international development strategies for years to come. And there hasn't been any specific World Population Conference after that. However, discussions on population-related issues, reproductive health and development have continued through various forms, conferences and global gatherings. Instead of a single dedicated conference, population-related discussions have been integrated into broader global forums such as United Nations General Assembly, Commission on Population and SDGs, summits, and various thematic meetings focusing on health, gender equality and sustainable development. We also have learners, population policies for special groups. For women, there are reproductive health services, policies promoting access to family planning, maternal health care and reproductive rights, gender equality laws, policies aimed at addressing gender disparities in education, employment and healthcare. Now, we also have special policies for children and adolescents. There are children welfare programs and adolescent sexual health education. Under children welfare programs, we have policies which provide healthcare, nutrition, education, and protection from exploitation or abuse for children. Under adolescent sexual health education, we have policies which focuses on educating adolescents about sexual health, reproductive rights, and preventing early pregnancies. We also have special policies for elderly population. There are elderly care policies and pension and retirement policies. So these are programs which addresses the healthcare, social support and specific needs of aging population and also ensures financial security and support for the elderly. We also have LGBTQ plus communities and there are anti-discrimination laws. Under these laws, there are policies which aim at preventing discrimination based on sexual orientation or gender identity. We also have healthcare inclusivity, where policies ensuring LGBTQ plus friendly healthcare services and support for mental health needs. We also have indigenous and minority groups. So there are cultural preservation programs and community development initiatives. Policies recognizing and preserving cultural heritage, language, traditional healthcare practices, and also they support socio-economic development of indigenous and minority communities. We shall now focus on refugees and displaced persons policies. So humanitarian aid and refugee policies, where programs providing healthcare, shelter, education, legal support for refugees and displaced persons. We also have integration and resettlement programs, where policies facilitating the integration of refugees into host communities are done. We have special programs and policies for persons with disabilities. Accessibility regulations, where policies ensuring physical accessibility in public spaces and buildings for people with disabilities. We also have employment and education support, where policies promoting inclusive education and employment opportunities for people with disabilities. Finally, we have socio-economically disadvantaged groups in society and focuses on poverty alleviation strategies, food security programs. Here, policies target at poverty reduction through access to education, healthcare and social welfare programs, and also policies addressing food insecurity and providing nutritional support for economically disadvantaged population. We now shall focus on the social gradients of healthy aging. The World Health Organization's framework on healthy aging emphasizes the concept of healthy aging, and it is not just the absence of disease, but the optimization of physical, mental, and social well-being as people age. Within this framework, the social gradients of health refer to the impact of social determinants on health outcomes across different levels of society. These gradients highlight how various factors like income, education, employment, social support, and access to healthcare services significantly influence a person's health as they age. People in lower socioeconomic positions often experience worse health outcomes compared to those in higher positions. And the differences in health status are seen as a continuum where each step of the social ladder corresponds to improved health and longevity. We also have the WHO framework, which emphasizes the importance of these social determinants in promoting health aging and advocates for policies and interventions that mitigate the impact of social gradients on health outcomes for older individuals. There is another branch which is known as, dear learners, geriatric care. So geriatric care in India is a specialized branch of healthcare that focuses on the health and well-being of older adults. It involves addressing the unique healthcare needs of aging individuals, typically those aged 65 and older. Although this age cutoff can vary in different contexts and healthcare system, but geriatric care in India has seen significant developments due to the country's aging population. As life expectancy increases and the demographic pyramid shifts, there is a growing need for specialized care for older adults. Some key aspects of geriatric care are healthcare facilities, where institutions offer specialized geriatric departments focusing on healthcare needs of older adults. We also have geriatric clinics. Many cities have geriatric clinics providing comprehensive healthcare services tailored for elderly patients, which includes nurses, physiotherapists, and social workers. We also have government initiatives. The Indian government has implemented various programs to address the healthcare needs of older adults. One example is the National Program for Healthcare of Elderly, NPHCE, which aims in providing accessible and affordable healthcare services. We also have community-based care, where initiatives focus on community-based care to reach older adults who may face barriers in accessing healthcare. These programs often involve mobile clinics, home healthcare services, and community health workers. We also have elderly homes and assisted living, where they offer a range of services from accommodation to healthcare and social activities. We also have certain challenges, and despite such progresses, it limits access to specialized geriatric, include limited care in rural areas, shortage of trained geriatric healthcare professionals, financial constraints, and lack of good quality healthcare. We also have technology integration, and there is an increasing use of technology. There is telemedicine services and health apps designed for older adults, which helps them in improving their healthcare and monitoring their health remotely. We also have social support alongside medical care. There are social support networks and NGOs and community organizations. Efforts are ongoing to improve and expand geriatric care services in India, and it has recognized the importance of addressing the unique health needs of the aging population. Now finally, the way forward. So we know that population problem, dear learners, is not just an issue of lack of awareness or education. It is intrinsically linked to poverty, societal norms, and cultural preferences, like preferences for a male child or larger families, etc. A mere focus on contraception and sterilization will not render the population control measures successful, and so will not the coercive and top-bottom approach help either. Also, adequate measures must be taken to take advantage of the demographic dividend of a country, so that population is not a burden but a resource in the rapid economic development of a country. Dear learners, in conclusion, we can say that the aim of a national population policy is to achieve population stabilization, provide reproductive healthcare services, promote education and awareness, ensure gender equality, support economic development, and manage migration and urbanization effectively. The long-term goal is to stabilize the population by 2045 at a level that satisfies the demands of societal development, environmental preservation, and sustainable economic growth. Thus, the National Population Policy serves as a guiding framework to achieve sustainable population growth, ensure reproductive health and rights, promote gender equality, and integrate population concerns into broader development initiatives. Its multifaceted approach aims to create a healthier and more equitable society in India. So, with this, let us conclude this module, and in the next video we shall be discussing, which is module 22, on population policies in India and their critical appraisal. Thank you so much.